Good day, everyone. You are welcome to another episode of the System Podcast. And our topic for today is medicine, a calling or just another paycheck. So I have this question that I always ask myself. Are doctors driven by passion for helping, or is it just another job? Now, it's very important for us to understand the motivations of doctors, especially in a country like Nigeria with significant healthcare challenges. So it's worth noting for us to ponder on statements like, are doctors as passionate about healing as they are being portrayed? Has the rise in doctor migration, aka Japa syndrome, affected the essence of care? Can one truly balance financial incentives with genuine empathy for patients? So now, let's look at the history of this concept. Medicine as a vocation. Traditionally, medicine was seen as a noble calling. You can refer back to the Hippocratic Oath and how medical practice has historically been associated with sacrifice and a higher purpose. But there is a drastic shift in perspective now. So, in fact, looking at the societal changes, we have more younger doctors who have different motivations. People want to have big houses, drive cars, which are nice, which is kind of different from the perspective of people in the past who are basically driven by the concept of healing people and trying to explore the human body, the intricacies and everything there. So, and there's a lot of economic pressure. Even before this current pain hardship, like looking backward, the lifestyle and the value of medical doctors have been drastically reducing. Now, I can reminisce back to some of the things which our consultants used to say, like Prof. Bello, who is a consultant, a professor in pediatric here in Aminu Kano Teaching Hospital. I could still remember when he told us that when he first came to Kano in the early days, like early 2000s or so, he said every week Kano state government used to employ new doctors. But now he knows, he told us that he knows many doctors who have finished for months being on ground without being employed. So you can see the drastic shift in so many things. And so with that, definitely the pay will definitely reduce. Prof. Mota have told us many times that his money, the first money collected for house job, housemanship, which is what medical graduates normally do before they go for NYC, said it was enough for him to buy a car, sustain himself with the cash. But the concept now is that a doctor is being, a house officer in federal institution is being paid 220,000 per month. This is nowhere close to even buying a bike. So you can see the whole thing. So you can see why things have been changing and things will be changing. So this is the concept. Now, let's also look at the financial realities of medical practice. If you look at the workload and the compensation, a doctor, it depends on which cadre you are in the medical practice. Let's talk about the resident doctors, which we have a lot of contact with, junior residents or senior residents. They are working almost within the clock, like they are working throughout the time, like they are always in hospital. And how much do they get paid for the compensation? A senior registrar kind of collect 350,000 a month. This is too bad. Like if you divide it into the days in a month and compare it with the hours that these people get to work, this is peanut. Compare it with someone who, before you even reach the level of a senior registrar, let's look backward and see what it takes to reach that level. Now you have to finish your primary school, secondary school, had to write the SSC, get a very good score, had to write the JAM. If you're applying a school like Bayero University Kano, you have to get at least 220 in your JAM score, and then you sit for the post UTME and you have to get a very high score and then come in, be admitted, pass through level 1, 2, 3, 4, 5, 6. If you are not lucky, you might repeat and add more year, and still if you are not lucky, strike could come along the way, and still you have to sustain yourself through the school, spend a lot of money. Then before you graduate, do your house job and do what they call it, the NYC. And if you still have to do a medical officer job for a little while to get some couple of cash before you register for the primaries, pass, then you come back to the teaching hospital for residency proper. The first part of the training is the junior residency, which mostly is 3 years. Then you go back, write another exams and go back for the senior residency training. You can see the amount of time, the investment, the energy and everything, and you are being paid 350,000. And most of these people are not even living in their hometown. They get to rent an apartment, bring their family, get to feed their family, fuel their car. So this is actually peanuts. So the compensation is not even, it's not even good at all. So there's also emotional strain and burnouts, a lot of burnout. The Nigeria part is so bad. It's too bad. Like there's a lot, I don't even have to talk about this. Everyone knows about it. And if you juxtapose this against their income, I just say they are sacrificing themselves because they don't have any choice. Because nobody would be in the right sense of mind to do something like this. That's just the thing. And that is why somebody can be in the level of a senior registrar and get an opportunity to go abroad. They will leave. So let me give you an example. If you see how doctors in Nigeria and abroad are compensated versus their workload, like if you take it, the only thing that a Nigerian doctor is waiting for is just to go to hereafter and be compensated, because it's very bad. It's very bad. So the next thing that you will also kind of look at, just look at this, the Japa factor. The Japa factor, it has been there, but it's been on a rise. Because of the hardship in the country, people are looking for greener pasture. I don't blame anybody. We need it. People are looking for better pay, better livelihood, better everything. And doctors don't really have personal gain of their own. You are always in the hospital but not getting much. So everybody's trying to find a way out. But the thing is that out there's good pay, but you have to know that the work is strict there too. I don't know much about that place, but I'm restricting myself and my conversation mostly to this environment, which I have a first-hand experience as a student and have communicated with so many resident doctors here. And so that's where most of my talks will be lying in. So there's this moral question that I always kind of ask. I ask my colleagues and I also ask myself. I'm not too comfortable and free to ask my consultants because it's somewhat controversial. Help or money? So if you kind of take the doctors' perspectives, like the senior doctors themselves, I would say these are people that they have become chronic in the journey, so they don't really think much about the money itself. So they would kind of tell you that, yeah, we are here to kind of just help patients, help them with their livelihood and all those kind of things. So that is what they might say. But I won't say all of them would say that. While if you take the younger generations, they would always tell you something like, yeah, this concept, I have to be looking for a better distance. I'll be working in this hospital. I'll have to rush to this private hospital to also add to it. There's no money here, there's no money there, and all this kind of thing. So there's also this thing that I always kind of think about: who feel conflicted between helping patients and seeking better financial reward. So who kind of feel conflicted? It's not something that's clear to really look into. The thing is that from one point of view, the patient is conflicted, and from another point of view, the doctor is. So it's just on the fence, and I believe I should leave it there. So what about the patient's perspective in the concept of help or money? So here, how do patients perceive doctors? To be frank to you, I would say most patients who are intelligent, who know what they are doing, they perceive doctors as people who are here to just do their business, do their job, get their pay and go. And in another way around, those who are not really knowledgeable, we see many of them here because this is the northern part of Nigeria, and not to really say something bad, but you can't compare it with the south, which you have a lot of educated people. So people here will kind of be like, okay, the doctor is kind of helping me. So some doctors are really empathic, they are selfless. In fact, they are even doing beyond what the system required them to do. Why some are doing below what the system required them to do. So, but the basic thing you have to know here is that in perspective from patient, it depends on which kind of patient. The educated one will tell you that this paying for my service, and that is clearly what I'm getting. And those who are less educated and maybe they have less money, they will feel like the doctor is being there to kind of help them. But as we go along, you see the whole picture. Can doctors both love their work and be well paid? Wow, this is, should I say, is a philosophical question. For somebody to love what they really do, you have to have surpassed the level of money. You have to have reached the level whereby your basic physiological needs and basic needs have been met. I must confess that most doctors have not even reached that level. So how can they even know that they genuinely love the profession? When you wake up and you are seeing that what you are doing is not really paying, it's more of like a YouTuber which comes into YouTube, start pouring out his passion, and money is not coming into it. You cannot put energy into giving good free value. Definitely, you have to get enough money from this stuff before you'll be able to start loving it for real. So in this case, I would say that seriously, someone cannot really love his work and without being well paid. Someone cannot love his work at all without being well paid. Now, a passionate surgeon who also earns a significant amount through private practice, does that make the work less noble? It doesn't make the work less noble. This is a question which people normally kind of say. They'll feel like if somebody goes to a private practice to add to his government practice, they feel like the person is not being content. They feel like the person is not doing a noble work. Now, I like to debunk this, that person is doing a clear noble work, because these people are just trying to get enough money to cover up their needs, because the system is not giving them enough to cover up their needs. The system is shattered. The system is broken. So people have to think outside the box and do other things that will cover up their expenses as they go. Okay, now I have conversed with a couple of doctors for a while now. I've been hearing from different doctors. Now, one of the things that I have asked a couple of doctors is that, do you still see this profession as a calling or as a job? Most of these doctors, what they normally tell us, it's not a direct answer, but it's indirectly saying that it's a job. They try as much as possible to tell us to think outside the box, to think where we can go and kind of get money, because there's no money in the profession. They've given up, they've given up in life, especially the old ones. They feel like there's no money in medicine, blah, blah. From this point of view, I like to say that, making money is just the concept of how much value you've able to put into the society. Doctors are giving value, but you have to realize that now the value has to be scalable. If you can't scale it high enough, you will not get as much as you want, and you either scale it via the quality aspect or the quantity aspect. If you want to scale the quality, you have to scale yourself as a doctor, make you be portrayed as a very great doctor, which big people like the politicians will want to come to. Or you scale the amount of people that you can see. No doctor can see 1,000 patients in a day. So you have to find a way whereby AI and tech can help you in this regard so that you'll be able to make much money. So in this, I would try to tell you that most of the doctors see the whole medical thing as a job, not a calling, except few people, as I always say, the very few ones that they will tell you that, wow, this is a calling, you have to respect it, blah, blah, and blah. But most doctors now see it as a job. Now, what I want to add here is that the concept of dual motives. Yeah, it's the best thing that we can really adopt, because this is a job. We have to put food on the table for our family, children, relative. We have to help people. So definitely we have to think about it as a paycheck. And also, it's a noble profession in the sense that you are directly dealing with life. So we also have to see it as a calling. But the concept of how we are going to balance it, it's a very hard thing, because if you want to completely look for the paycheck, the common man will not see a good doctor. They would only be seeing the Jews and all those kind of people at the primary healthcare, and the big doctors will try as much as possible to go to the big places to be able to see big people to kind of get money. But that being said and done, that being said, we still have to prioritize the most important thing. Try to make money as fast as possible. Think of other means. Think of how we can be able to leverage technology. Think of how we can be able to do other external businesses. Think of on how we'll be able to invest into cryptocurrencies and other things, and be able to get other source of money, so that in that way we'll be able to see medicine as a calling. There's also the concept of personal fulfillment and the societal pressure. Everyone has something they want to fulfill for themselves, either for themselves, for their family, or for their children. And this is unachievable without money. Look, gold medals is not grown by dream and by just thinking up and down randomly. Gold medals have been grown from sweat, hard work, hardship. You don't get to grow all these things and you invest your life and energy to be able to grow all these things. So if money is needed in all these things, your children need to go to good school before they will become good people. Definitely, your job have to make money for you. So with that regards, people have to think of other options, because the medical system is somehow broken, and we can't all run away from it. We can't all completely make it unaccessible by putting very high prices on the patient. We have to kind of maintain the patient in the way we can, but still the same way our families and our children have expectations on us. And still societal pressure, let's start from society. they have some expectations on doctors. They feel like doctors have a lot of money, them wearing suit and necktie. There's something about that suit and necktie is the most awkward thing. Once somebody wears suit and necktie, you can see a roadside mechanic who looks very dirty and earns a lot much more than that person that wears suit and necktie. But because of that suit and necktie, everybody will be like, hey, this guy is supposed to be having this and that. And your profession puts you in a position whereby you want to maintain the profession itself is money. Everybody expects a doctor to have a car, which is not by force, but they expect you to have a car. You kind of like push yourself, get a car, and that car have to be maintained, which is a liability. This is something which Robert Kiyosaki have been talking about for a long period of time. It's more of like a liability. So you have to have a car, you have to buy all these fancy clothes, necktie, all those kind of things. So these are some of the expectations which the system kind of have on us. So I would like to encourage everyone to ponder and to like reflect on this thing, especially if you are a medical person. This is the best time. This is the best time for us to start thinking on how we will think of external way to make money, how to really monetize our medical practice, because this is a business. This is a business. And if you take it as a business, the patient himself will even be happy. I've seen doctors saying, I'm helping you, but at the same time, they are not really helping the patient, but they are just saying it in such a way that, they believe that they are just helping the patient. You understand? So I'd like you to pour out your opinions in the comment section, because this is a very important topic to all of us in the medical system, and the tension between altruism and compensation in the medical field, and how both doctors and patients need to be more understanding of this duality. It's a very important thing for us to keep pondering on. So I'm very grateful to all you for tuning in and going through this episode, which is a very important one. So I'd like to leave you with some notable quotes. Medicine is not just a science. It's also about human connection. I wanted to help people, but now I see that I need to help myself first. Passion fuels the journey, but reality pays the bill. Thank you very much for being real. This is New Fight.